My name is Patricia Bolton. I'm a pediatric nurse practitioner. I work at Hudson River Healthcare in Armenia. I'm going to talk today about the HPV vaccine. HPV stands for Human Papilloma Virus. And I'm going to talk first a little bit about the disease to explain why we have the vaccine. HPV, or Human Papilloma Virus, can cause cancer of the mouth, throat, or anus or rectum in people. In women, it can cause cancer of the cervix, which is the bottom of the uterus. In men, it can also cause cancer of the penis. In addition to causing cancer, the HPV virus can also cause warts in the genital area of both men and women. Another rare complication of the HPV virus is that it can cause something called papillomatosis, which is a type of warts that can spread to the infant when it passes through the birth canal of the mom. And babies that are born with this can have some hoarseness when they cry or trouble swallowing. HPV virus is spread by sexual activity. It's a very common infection. 80% of people in the United States will develop an HPV infection in their lifetime. According to the CDC, there are approximately 14 million new infections of HPV in the United States every year. Half of these infections occur in younger people between the ages of 15 and 24. For most people, the HPV infection can clear on its own, but in some people, the infection will go on to cause cancer. If a woman went on for years without testing so that the cancer was not picked up, she might possibly start having problems like a lot of bleeding or pain in that area. Initially, if a woman had cervical cancer, they wouldn't know. That's why routine screening is recommended for that in women over the age of 21. They should go every year or two to their gynecologist to get the testing. It used to be called a Pap test, and now they just call it cervical screening. That test is to check for cervical cancer. In women, even though this vaccine is highly protective against cervical cancer, it would still be recommended once the girls get older than 21 that they still get the Pap test or the testing for cervical cancer. So the main symptoms of HPV in an older person that had the virus that developed into a cancer, it could look like kind of like cauliflower or warty looking lesions in your genital area, like around your anus or your vagina. And if you find something like that, then you should be seen by a medical provider to make sure that, or to find out what it is. Every year in the United States, HPV can cause about 32,500 cases of cancer. There is a vaccine that can protect against this type of cancer. It prevents about 30,000 cases of cancer in the United States every year. Even though you had exposed to the infection, it prevents you from developing the disease or the cancer. It can prevent about 70% of cervical cancer, 80% of anal cancer, 60% of vaginal cancer, and possibly cancers of the mouth also. It is also highly preventative against genital warts. The vaccine is not new. It's been in the United States since 2006. There was a new updated and improved vaccine that started in 2014. There are currently, it protects against 9 different strains of the virus. And these strains were chosen because they're the strains of the virus that cause most of the disease. It's highly recommended by numerous medical and scientific agencies, including the Center for Disease Control, the American Academy of Pediatrics, and the American Academy of Family Physicians. Some states are actually now requiring young people to get the vaccine in order to be in school. Those states include Virginia, Rhode Island, and the District of Columbia. In New York, the vaccine is not currently required, but it is recommended. The primary reason it's given is because it protects against cancer. So it's really a cancer vaccine. There's only one other vaccine that protects against cancer. That's the hepatitis B vaccine. The hepatitis B vaccine protects against cancer of your liver. Any vaccine or medicine that we take in our bodies can possibly cause side effects. The most common side effect of the HPV vaccine is soreness of the arm. The kids will complain that their arm hurts, probably for a day or so after the vaccine. If they apply something warm to their arm, or for example, just take a nice warm shower and move their arm around, that pain will go away within a day. Kids can get a little bit nervous when they get the vaccine, and they can faint. And that can actually happen for teenagers with pretty much any vaccine. But whenever the HPV vaccine is given, it's recommended that kids wait for 15 minutes just to make sure that they feel well before they leave the clinic. Overall, the HPV vaccine has a very good safety record. Other mild problems that can occur following vaccination are fever, headache, and other body aches, which are similar side effects to those found with other vaccinations also. It can be administered to young women through the age of 26 and young men through the age of 21. The vaccine is more effective when given to younger people. It's generally recommended starting at age 11, but it can be given as young as age 9. If you start the vaccine when the kids are young, you only need to have 2 doses because the vaccine is more effective. So if you start the vaccine at 11, it would be recommended that your child come back 6 months later to get a second dose of the vaccine, and then they're done. If the vaccine is not started until after age 15, 3 doses are needed because the vaccine doesn't work quite as well, and 3 doses are needed to get full effectiveness of the vaccine. So in that case, your child would get 1, they would come back a month or 2 later to get the second dose, and then 6 months after the first dose, they can get the 3rd dose, and then they will be done. I would highly recommend that you consider getting your child vaccinated against HPV or Human Papilloma Virus. This vaccine could save their life.